Good morning, guys. Today it's Friday. We like to say Happy Friday, folks, around here. It's kind of my thing. I like to keep the mood light and fun on Fridays. Every Friday since about January, we've had a young guy in named Danny who is a volunteer who's applying for PT school this summer. And he gets to hang out with me as I do my PT sessions, and he watches, he observes, I give him lots of information. We talk a lot in detail about what's going on, and I'm really at a point of trying to help prepare him to apply for PT school and get a little sense of what we do and some different ideas that can be done in the physical therapy world. So Danny's been around for 4 months, 5 months now, and I'm going to ask him a couple questions. So I'm going to flip the camera over to him, and we're going to just kind of ask a couple questions about his experience at CORE. So, all right. So Danny, welcome to the show.
Oh, thank you.
Now the truth is that Danny loves coming here because of my dog Dudley.
It is true.
I will say that first and
It is true.
foremost. So Danny, tell us your experience about college and kind of what led you to want to become a PT student.
Initially I went to school at UT, and I was actually a history major. And then, of course, liberal arts didn't tell you that there's no jobs. I ended up becoming an elementary school teacher, and I taught for about 3 years. And I did like it, but after a while, it just started to, grind me down. And so I decided to make a change, and my dad's a doctor, and so I've always kind of had an interest in the medical field, but I knew that I didn't want to really be a doctor, just because of the hours and stuff.
Same with me, buddy.
Yeah, so I was just kind of exploring, like what are some of the different, avenues that I could take. I knew I had to go back and take a lot of science classes, so it gave me a little time to kind of just figure out which avenue I wanted to go to, and I did a bunch of research. I was thinking about, maybe being a physician's assistant, a pharmacist, and then a PT, and I did some kind of research and talked with some people, and just didn't want to do pharmacy. I didn't really want to do physician's assistant, and just was like, okay, well, let's try out physical therapy, because I have been to physical therapy, and I had a lot of benefit from it, and it was just seemed like something that would interest me. So I've been coming here and going to different PT clinics, and this is definitely kind of something that I've seen that I would want to do.
Tell us about the other places you've been. What kind of settings? The hospital?
So I have been I've been observing at the Westlake Medical Hospital, and it's different. They do a lot of manual therapy, but then they do a lot of other exercise and stuff. But I mean, it definitely kind of feels more like a hospital. I mean, the PTs, they're all very nice, and they definitely do know their professions like very well. Like, but it feels even though it's a very nice hospital.
Nice hospital.
I've never seen a hospital that looks like this.
Yeah.
I mean, it still feels it feels very like antiseptic.
Yeah.
Like and very not as like warm.
Yeah.
It feels more like you would think it's like a hospital. It's kind of more serious,
Yeah.
and
Yeah. White lab coats everywhere.
Scrubs, and and don't get me wrong, like everybody knew their jobs and everything, but it just had a very different feel.
Yeah.
Very business, very, like lots of rules.
Yeah.
Yeah.
Lots of rules.
Yeah, they're like, I remember like getting in there, I was like, oh my god, there's a lot of rules, and
Yeah.
I'm literally just watching these people not doing anything. And they like pages and pages of like things I can't do. It's like, okay, got it. So yeah, but I mean, like I said, they did, like I had some really good experiences with the physical therapist there, but it was just a different kind of atmosphere. Yeah.
So tell us about what you've learned or experienced here at our facility that's been interesting to you or different than what you expected.
So definitely, what is different than what I expected is really just how much y'all try to work with people and try to like save them as much money as possible. You know, with you know, you starting out with kind of like the manual therapy and giving them the homework and stuff, and then sending them on to the trainers, and also just kind of the whole like program that you go towards is more oriented with them helping themselves and getting better for the rest of their life, like long term, instead of well, you come in once a week and you do exercises and maybe you do the homework, maybe you don't, but you know, it's going to be more about you know, you coming in and me fixing you, whereas like this is more, it seems more oriented with like the specific patients or clients like needs in mind.
Yep. Whereas
a lot of other places are very kind of follow this formula of like, okay, so you've got back pain, so we're gonna do like, you know, we're gonna do this manual therapy, and then we're gonna do these exercises, or like if you have shoulder pain, we're gonna do this and this, yeah, and like, and definitely like at like, you know, definitely not discounting like all that other stuff.
Sure.
Like, I mean, I definitely saw at other places like people were really, you know, they were improving for sure.
Totally.
But it just has been interesting. Like here, there's kind of a more, like you take a more holistic approach to this stuff, and kind of more, which makes sense to me in that, you know, have just, you know, with all the classes that I've been taking with just, you know, learning about the human body in general and stuff, is like everything is so interconnected, and it makes sense to me that, like when you were saying, like a lot of people that have like lower back pain, is like they're tight in their front, like they're tight, you know, in their, you know, pec minor, and then, you know, the psoas and all that kind of stuff. That makes sense to me that to treat that kind of stuff, because of the whole like agonist antagonist kind of muscles thing going on. Hey, Reese. So that's kind of like been a big difference, and then also just kind of the whole feel of just the office in general. Yeah.
Down dog, I got it.
Yeah, downward dog, stretching it. Just the whole feel of the office seems, you know, with like the Pilates machines and stuff, you know, since they're made out of wood, and even in like the gyro stuff, it's like, yeah, it has some metal on it, but a lot of it's made out of wood. So to me, it has more of a like kind of therapeutic feel to it
versus like a gym feel.
Versus a gym feel, which, you know, like I love to work out. I mean, I don't have a problem with like gym equipment or anything, but like it just kind of feels different. Like the atmosphere and like the whole mood of the place feels a lot different than like a lot of the other places that I've been.
Yeah, and you mentioned something about like long-term plan, and the whole idea is that it is like a lifestyle change.
Mm-hmm.
It's not just about getting out of pain. And
right.
what I tell so many people is that like pain is what moves people to get here. Mm-hmm. And as soon as pain is gone, is a lot of times the excuse for people to leave and be done with the plan.
Right.
But the reality is when the pain goes away, which is what we expect, that's actually when the benefit of the Pilates and gyrotonic work comes in, to get better long term, so it doesn't come back.
Right. So
that's really the key. It's that it's a lifestyle change, and knowing how, and giving the patient some power to help themselves and not be reliant on me or my staff to give them relief,
Right.
but them find a way to manage and create their own relief.
Right,
And then
exactly.
the lifestyle change of being aware of posture, being aware from here, leads to improved day-to-day functional stuff and whatnot. So, all right, man. What advice would you give to a kid in college who is thinking about going to PT school as far as like getting volunteer work? What's your advice on that?
I had trouble finding places. Like calling like places all the time. I would usually get the runaround of like, well, we'll call you back and blah blah, and stuff like that. So for recommendations, I would say call as many places as you can and try to get in to lots of different places. One, because schools, that's what they want to see.
They want to see variety.
They want to see variety, and also two is go to different places so that you kind of see a variety of stuff, and then you can get a better idea on what kind of therapy would be interesting to you.
Yeah. 'Cause there's lots of choices.
Yeah, because there's lots of choices. Which before kind of looking into all of this stuff, I didn't realize there were. Yeah, I mean, I really just thought it was just like
Outpatient orthopedics, and in the hospital.
Right, exactly. And I mean, I didn't even really realize that the PT amount of stuff in hospitals. Like, I just really just had this idea of just PT outpatient.
Yeah.
That's really all I had. And
have you done any wound care?
I
I think that was my biggest shock, is that as a PT, they do wound care, and when I did my internship in the hospital, I had to learn to do wounds, and I knew I was never going to do it when I got out of PT school, but I had to learn it. So
like every time I went into the hospital, a lot of it was like since it was at this hospital down here,
post-surgical stuff.
Yeah, it was a lot of because I mean they don't have like a really like intensive care unit or anything. Like it's really it was really just like you could tell most of it was just orthopedic surgeries, like knees, hips, a lot of. So there wasn't like I know that they would like, especially in outpatient, they would work on people's scars and stuff, but there wasn't like wound care. It was a lot of like getting people moving around, showing them how to do the exercises, showing them how to walk with crutches and that kind of stuff.
Got it. All right. So I think that's it for our little interview of Danny. He's been around for. I'm going to flip the screen. So we got to chat with Danny and hear his story about how he what kind of led him to want to go to PT school. And my story is very similar. I watched my brother actually go through med school, and I knew from watching him go through med school that I did not want to be a doctor. Back then it was about pagers. Everybody had a pager on. I'm aging myself a little bit.
Had pagers. Had so many pagers.
But the pager is what really scared me from being a doctor. And now I have a cell phone that anyone can contact me anytime, and we all do. So it's kind of funny. But same thing. Physician's assistant school was not available at that time. So I was looking at pharmacy. Vet school, dental school, med school, and I started marking them off as no, and then PT was the one thing that kind of I felt gave me the best chance to spend time with people and get to know people and actually solve their needs and meet their problems, instead of just being a situation where I was counting pills all day or doing whatever. So
and that's the other thing about this place is it really does seem a lot more like I could tell that the clients really know that like you have their best interest in,
for sure.
And
they want to be here. Even though we don't take insurance, and even though it is expensive, and these people are willing to invest in their health because they see the benefit of the lifestyle change that we're creating.
And not just that, but it's like you try to work with people like as much as possible, which to me, I would appreciate, because there's so many people just trying to get money out of you all the time. Like it's like every day, you like somebody, you know, you get calls from whatever, or you know, you got to buy this, and so somebody actually trying to work for you and save you some money. That's, I mean, to me, that is, you know, something that you would not expect from the medical profession, just in general.
And I will say this: I do a lot to try to make my place not medical.
Yeah.
You know.
Yeah.
But and I think we do a pretty good job of that. So, all right. So if you're around on Fridays between now and for a while, however long, till hopefully till Danny Boy gets in school real soon, be prepared to hang out and hear Danny and I talk about your case and what's going on. I always say this: when I talk to you as a client, you hear it, but I'm talking to you. When I talk to Danny in the room about you, you hear it differently when someone's talking to that person about you. So I really enjoy. I enjoy when people bring their spouses and family or friends, and I enjoy having a student around because that conversation taps into a different place with many different people. So, all right, that's it for today, guys. Y'all have a great Friday. Have a happy weekend.